Think if you have insurance from your work, Obamacare won't hit you? Well, why wouldn't you?
If your employer provides you health insurance on the job, nobody is talking about messing with that.
So no problem for workers getting coverage from employers, right? Wrong. Fox confirming a report revealing the law actually expects 66% of small business plans and 45% of large company plans to get hit by Obamacare. That could mean up to 93 million Americans may get cancellation letters. Are you one of them? Hi, everyone. I'm Brenda Butner. This is Bulls and Bears. Let's get right to it. Here they are, the Bulls and Bears this week. We have Gary B. Smith, Tracy Burns, Jonas Max Ferris, John Layfield, along with Bernard Whitman. Welcome to everybody. Okay, Gary B., another broken promise?
Yeah, absolutely, Brenda. You know, the only word I can think that describes this is despicable. One, you know, as you pointed out in, right at the top, it's not going to be, 5 million, 10 million people. The number, as you pointed out, is over 90 million people. That's over a quarter of the population that were, one, lied to, and two, now forced to go on to plans that are invariably cost more than they're paying for now. So this whole canard of you can keep your plan, and even if you have to keep your plan, you search for a better one. It turns out, Brenda, it's lie upon lie upon lie. And not only that, maybe the worst part, the reason I say it's despicable, they knew all this well before Obamacare was implemented.
Well, Bernard, what do you think of that?
I think it's hysteria gone wild. I mean, come on. If 93 million people were about to lose their health insurance in the next 2 months because the year ends in 2 months, I think we know about it by now. I don't buy this at all. And in fact, their whole reason behind the Affordable Care Act was that the cost of premiums was rising so dramatically from 11% of median income in '99 to up to 24% in 2020. We're finally bending the cost curve here, and we've seen this year cost rates for health care going up by the least amount in 50 years. And I know as a small business owner, I get my plan dropped all the time. 3 times out of the last 5 years when I've gone to re-up my plan, it's not been available. I've had to change, and unfortunately I've had to change to a plan with lower benefits and higher premiums. This is finally going to change that.
So John, is it going to make it better, as Bernard says?
No, it's not going to make it better. Look, this fallacy, and it is another fallacy. I mean, you got to understand, these guys have spun this magnificent tale. We have been sold a bill of goods. They talk about health care premiums coming down. They started coming down in '09. Before Obamacare ever kicked in. It has to do with the recession. Studies have shown that over 80% of it has to do with the recession, not with anything to do with Obamacare. But yet they tout these numbers, as politicians do. They've said that no one will have to lose their policy. That's not true. Nancy Pelosi says policies will not go up. That's not true. Mike Enzi, Republican from Wyoming, tried to pass a bill because he knew that healthcare, small businesses would lose their healthcare plan. He wanted those grandfathered in. The Democrats voted this down. They knew this was coming. They have completely sold us an absolute bill of goods here.
Well, Tracy, shouldn't you be worried if you have an employer plan then?
I think everyone should be worried. And Gary B., I got a better word for you. I think it's deceitful, because they knew back in 2009 that there were going to be people that were turned down. They knew a lot of people were going to be turned down. And they also knew that people were going to be forced into costlier plans that didn't provide as good of benefits as they currently have, because, well, God forbid, everybody's, not on an equal playing field. So I think they knew this was going to happen, and we were just slowly learning more and more about what they knew, and now the public is starting to get a sense of it.
Okay, Gary, Jonas, you actually think it's good for some, bad for others?
Yeah, look, it's a program with winners and losers. If you're in the top half of the healthiest Americans, in the top half by income, you probably are going to take some hits here, whether you're going to get a plan that's more costly or more benefits than you want. If you're in the bottom half or the bottom half by health, you're going to get a cheaper, better plan. You get a letter, but the letter, you got to really read it. You're going to get a plan in many cases that's better. And you may have to pay for it. You may pay more. You may pay less. It depends how the whole thing flushes out. But you're going to get plans that meet these higher standards. The takeaway is they want everybody to have a certain high-level plan. It's like the opposite of what Bush wanted to do when he wanted to have a high-deductible plan that you paid more out of pocket. This, you're going to pay less out of pocket and have more coverage. That doesn't benefit everybody, though.
Okay, Gary B., you've heard from Bernard and Jonas, who argue this may not be as bad as we think. How bad do you think it's going to get?
Well, the numbers show it. Look, if this was great, if I personally, when I did my own insurance, thought this was so great, I'd be running to these exchanges. I've already gone to the exchange. I've gone to my Blue Cross Blue Shield, and I can't find a better plan at the same price. In fact, what I'm finding is worse plans because they tack on this crap like maternity care and substance abuse, which I don't need, for a higher premium, for crying out loud. So it's absolutely ridiculous. This is forced upon us. Bernard said I know Bernard is a nice guy, but he comes up with this hoax like bend the cost curve. My God, we heard that 6 months ago. You know where the cost curve is being bent? Right around our necks.
Okay, you are a nice
Better
guy,
than out of our
Bernard,
wallet.
Well, it is hitting our wallet, though, isn't it? Bernard?
No, I mean, I think, honestly, look in New York State. People in New York State on the exchanges are going to pay up to half of what they pay elsewhere. And you know who's really at fault
How many
here?
have signed up to do that?
The Republican governors who
6.
refused to launch exchanges on their own,
Yeah.
and abrogated the responsibility to the federal government. The federal government exchanges are not going to operate as effectively, I think, as the state exchanges, and that's the fault of the Republican governors.
I think it's unfair. We're forcing people into plans they don't want. I don't want maternity care anymore. I'm done. There's no reason to pay for that kind of stuff. So we're being forced just to even the cost structure. I'm being forced to pay more so that people who didn't have it in the beginning will have something. That's where it becomes unfair.
Well, John, it would be one thing if we were being forced into more affordable, better care, more useful plans, but that's not the case, is it?
No, it's not the case. How many stats can you cherry pick from the side that's arguing for Obamacare? Everybody quotes New York State because of their healthcare system. It is the only one that's going down. There's about 49 states that are going up. California is triple-digit increase right now. I mean, these guys cherry pick every stat they have. They say they don't even know the numbers from the website. You can go on Google Analytics. It doesn't cost you hundreds of millions of dollars, and you can find out almost anything you want about any website except for this government website. These guys have completely, I keep saying it, they've sold us a bill of goods. They have flat lied to the American people. And the people that are getting a cheaper insurance, it's because of subsidies. Somebody is paying for that. It's not free pizza, guys. Somebody's paying for this.
The other insured people are paying for it, and that's how it works. But isn't that better than the alternative, which would be nobody pays for it but the very high taxpayers? Because that's how most health care is covered in America. The people at the top pay for everybody else, and nobody sees a premium increase. That's how Medicare is paid for and Medicaid. So isn't this a fairer system where at least half the country might see higher premiums, so the other half who have conditions that they never could afford?
What's fair about that? What's fair about that? And these so-called tax subsidies, everyone's pricing out of them. I mean, they're only basically available to a handful of people by the time you run the numbers. There's nothing fair about the way the cost structure is. And to add insult to injury, the care is not going to be there for you.
And the fact is, though, we have been paying and subsidizing to pay for people who do not have health insurance for years. Why? They go to emergency rooms, and the rest of us are stuck with a very expensive, inefficient bill. It's about time that we level the playing field and be able to reduce costs in that manner.
Okay, Gary B., 10 seconds.
But here's the problem. Here's the problem. We'll wind up with more uninsured now as people get dumped from their plans. So we've not even solved the core problem that Obamacare was supposed to solve.
Okay, that's got to be the last word. Thanks. All right, sticker shock from Obamacare isn't just sticking it to folks shopping for